We can't change our genes, but we can change the environmental influence on those genes. Headaches we subdivide into primary and secondary headaches. So if we think about a secondary headache, the answer is a little bit more easier on the why, because there's a secondary triggering phenomenon. The key component of that, though, is that it does have to have a viewed cause and effect relationship and not just assumed one. Oftentimes the assumptions can be wrong. Sinus headache's a great example of that when it's not necessarily a sinus headache. Probably the bigger question is primary headaches and the why of the primary headaches. And the ones that are most often brought to clinical attention, at least on a frequency basis, are going to be migraines. For the population that I tend to see more, which is children and adolescents, and there's a strong evidence that these are genetically based. It's known by the patients already. It runs in families. And so usually the family member may have headaches. They may not know they have migraines, but the family history sort of brings out that evidence that there's everyone in the family that has headaches and migraines. So, and the science is now backing that up with more and more gene polymorphisms that are being identified as contributing factors. So migraines truly being one of those diseases that we can call a polygenic disease caused by multiple genetic associations. Well, if we think of then as the basis of migraine as genetic or polygenetic, we can't change our genes, but we can change the environmental influence on those genes. So one of the first and easiest ways to do is take good care of yourself. So in our patients, we talk to them all the time. We call them our 4 healthy habits, which is making sure they get adequate fluid hydration, preferably without caffeine. Now, there are many adults that are caffeine addicted, which they know if they don't get their caffeine, they're going to get a caffeine withdrawal headache. So in those instances, you want to avoid the caffeine withdrawal component. Caffeine doesn't cause the headaches, the withdrawal from it causes it. But preferably probably better to be without the caffeine. Secondly is to exercise. There's good evidence that exercise not only makes our body healthy, but it makes our brain healthy, improves vascular flow, but it may change the neuropeptide relationship. So if our brain is under a high stressed, metabolically stressed condition, then having the influence or the ability for your vascular system and the neuropeptides to respond adequately to that can be contributing to regular exercise, at least 4 or 5 times a week for at least 45 minutes or longer seems to be adequate to produce that neuropeptide effect. Thirdly is nutrition. That means not skipping meals and eating healthy. At least in our group, and I think a lot of the evidence shows that the avoidance of foods is probably not all that good. There may be certain food products, MSG is one that's notoriously known for that, but for the most part, most of those have been either discounted or they may be more psychosomatically induced, is that somebody ate something, they blamed it on that food, and then it's self-fulfilling every time they eat it because they're worried that it's going to be causing it. So we approach it much more to have a healthy diet, so plenty of fruits and vegetables. Many of the nutrients in vegetables can have an association with prevention of migraines. Folate and riboflavin are 2 that tend to be frequently cited. Even though there are many people in the world that are vegan and vegetarian, but coenzyme Q10 comes from animal products and seems to have some properties for helping to prevent migraines. And then there's growing evidence that vitamin D isn't just a bone vitamin, but maybe is associated with chronic pain disorders, including migraines. And then the final healthy habit is getting enough sleep on an adequate, regular basis. So it's not only important to not be sleep deprived by doing a short nap every night instead of a full night's sleep, but the shifting sleep, advanced and delayed sleep, or what we call jet lag effects from westbound or eastbound. It does appear that eastbound jet lag tends to have a contributing factor to migraines. And for the adolescents that I care for, that's critically important because many of them, their natural sleep cycle is midnight to 9. During adolescence, that's what melatonin helps regulate. But most of the school systems in the country make kids get up at 5:30, 6 in the morning. So every weekend, they're going through a westbound jet lag when they hit the weekend. And when the school day starts, they have an eastbound jet lag effect. And what we see is that Monday and Tuesday are the 2 worst days of the week for most adolescents with headaches. More and more evidence is showing us it's not necessarily what we do, but how we do it. So medications play a role. Sometimes they're a bridge, sometimes they're a treatment, but how we explain it to our patients, so our patients are understanding what's going on. I end all my sessions or my appointments with my patients and say, my job, do you have any questions? My job isn't just to treat you, but to educate you. So if you do have questions, make sure you ask. So spending that extra time to answer those questions are likely to improve the outcome of those patients.